everybody, welcome back to the ADHD Women's Palooza. Oh my gosh, I am so glad you have joined us because this session we're talking about a brand new topic. We've never touched on it before. And I think that if you have showed up for this session, you probably know something about diabetes. You might have diabetes. You may wonder what's the connection, if there is one, between diabetes and ADHD, or maybe you have family members, because diabetes, of course, can be generational. So I'm glad you showed up because Nicole's going to tell us a lot of good information about this. I am Linda Rogley, and I co-founded the ADHD Women's Palooza back in 2016, which is actually, this is our 9th year of the Women's Palooza, and I am so happy about that because we have had just a vast array of cream of the crop experts with information that's really cutting edge, because I tell you, 9 years ago, we didn't even know that there might be a connection between diabetes and ADHD. I mean, it made sense, but we didn't really know. There was no research on it. So anyway, we are catching you up every year with accurate information. And of course, you know, there's a lot of stuff out there that is a little suspect, and maybe not intentionally, but sometimes we just can't always trust everything we hear on the internet. However, you can trust what you hear on the ADHD Women's Palooza. Couple things before we jump in. Number one, you know that you signed up free and we don't grab your credit card information, none of that kind of good stuff. You can send this link to anyone that you want to. They have it free for the same amount of time that you do. It's 27 hours this year, so that Janine gets an extra 3 hours of sleep. Thank you very much. She appreciates that. And you get an extra 3 hours of access as well. So please, if you know someone who you suspect has ADHD, or they know, you know, they're diagnosed, invite them to the Palooza, for heaven's sake. It's not just Nicole's session today, but all the sessions that were released today, including our little 5-minute morning mindfulness meditations with Dr. Mark Burton. That's a lot of M's in one sentence. I want to tell you, Mark and meditations and mindfulness and morning. And on Monday, we have a Monday one. Anyway, that's true for anyone who signs up. So that's my gift to you, as well as, of course, you can download a free session from last year as well, or in one of the previous years. You, of course, can purchase all of these sessions. We have more than 30, anyway, for $97. That's half price this week. So consider that. Information's coming to you. Not going to belabor that, but I do want to mention that we, as always, have a live session on Saturday. It's from noon to 4 Eastern time here in the United States. Again, we have a time converter for you so you can figure that out. We have women who come back and over and over and over because it gives to the pink ticket party, because it gives you an opportunity to talk to each other. And it's really, really great to hear from the experts and learn strategies and information and research, etc. But sometimes we just need to get down to the level of I get you. And that's why we have breakout sessions, so that you all can talk to each other. We cap that, by the way, at about 50 or 60 women, so that we don't have too much going on. We have enough for diversity, but we don't have 1,000 women. I just won't. That's just too busy for all of us. We would be overwhelmed, just so you know. So I am so happy to welcome back Nicole Demasi Malcher, and she is, yay! Oh, I'm so glad you're here. She is, as you probably remember, a registered dietitian. She is also a certified diabetes care and education specialist. So you know why I really wanted her to talk about this today. She has a master's degree in nutrition and food science, and she is one of us. She had received her diagnosis at age 33, and she struggled with eating and body image for most of her life. So her years as a dietitian helped her uncover the connection between ADHD and eating that is maybe not quite on the level of where we want it to be. In 2020, 4 years ago, she founded eatingwithadhd.com. So please visit that website. She has an online course. She has coaching. There's also an online community. It's helping hundreds of women with ADHD simplify their eating. We don't have to cook 10-course meals, stop binge eating. And I have to say that once in a great while, that certainly is me, and heal their relationship with food and their own body image. And that is something that's also, we'll talk about body image another time, but I'm just so thrilled that you are doing this important work. Thank you, Nicole. And thank you so much for being here again.
Thank you, Linda. Thank you for having me.
Okay, so let's jump right in. Let's talk about diabetes first, and then we'll kind of weave that connection in. I think most of us have heard the term. It's been bandied around all over the place. But
Mhm.
let's talk about what it really is. And there are more than one type. And what does that mean? So the floor is yours, my friend.
Thank you. So, yeah, diabetes, I feel like it is common. There's a lot of types. I think the most common type that people hear about is type 2 diabetes. So I'll
Mhm.
tell you the difference between type 1 and type 2. Then there's a couple other types as well. But type 1 is actually an autoimmune disease,
Mm.
something that typically happens in early on in life. It used to be known as childhood diabetes, because you do get it usually at a young age, although some adults do get it, and it's kind of like a late onset diabetes. Um, but it's basically where the body attacks the cells in the pancreas and your body is unable to make insulin. Insulin is a hormone that is released by the body, and it's what actually helps to get these cells, or sorry, the energy that we eat from food into the cells.
Ah,
So when you're not able to produce enough insulin, your blood sugars rise and they just stay elevated and they stick around in the blood rather than getting into the cells to be used for energy. So I always think of insulin as like a little key that unlocks the cells to be able to allow the sugar that you get from your food to get into the cell. So I kind of picture this, let's say you eat an apple. The apple goes into your body. It offers carbohydrates. Carbohydrates are your body and your brain's main source of fuel. So that sugar gets broken down into glucose or sucrose, all the tiny components. And then that stays in the blood until the insulin is released. That opens the cells, allows it to get into the cells for energy. And then you're back down to a normal level within a couple of hours. Well, if you have diabetes and you're not making enough insulin, like with type 1, you just don't make any insulin at all, or you make a very small amount. And so you have to take insulin injections for your entire life in order to survive. With
right.
type 2, it's a little different because you're typically born with the right amount of cells that your pancreas needs to create insulin, but there's something that happens along the way that's going to create what's called insulin resistance. Insulin resistance is when your body is not making enough insulin, or it's not actually using the insulin that it makes effectively. So let's say there's the receptors on the cells are not quite working,
Mm.
or maybe the insulin is there, but it's not unlocking, like the key's not working to open up that cell. So what
Yeah.
happens is, to overcompensate for that, your body starts releasing more and more insulin, and that's what's known as hyperinsulinemia. So when people can go and get their insulin levels checked and they find they have high levels of insulin, then that kind of shows maybe they have insulin resistance. And typically what's going to happen in this situation is you are going to have some symptoms for the most part.
Okay.
So some of the symptoms that people recognize, or that I recognize in my clients especially, is excessive thirst,
Ah,
excessive hunger, frequent urination, fatigue. You can have maybe sores or cuts that don't heal really well, especially if your blood sugars have been elevated for a long time. There can
mm.
be some tingling or numbness that you get in the hands and feet,
Mhm.
sometimes difficulty seeing. And again, these symptoms depend on how long you've had it and the severity of your levels of blood glucose. But so with type 1, it's the autoimmune. Type 2 is something that creates insulin resistance in the body. And then there's also gestational
Wait, wait, stop,
diabetes
stop, stop,
as
stop,
well.
stop. But if our body is producing more insulin, how is that insulin resistance?
So your body is resistant to the insulin that it's making. So even though
Ah,
your pancreas is producing more and more insulin,
yeah.
what's happening is the cells are not able to, the insulin's not able to open the cells to help get
Okay.
the insulin in there. So what happens is your pancreas just kind of wears out. The cells tend to wear out.
Got
And
it.
then over time, that's what creates type 2 diabetes. So for a lot of people, when they have insulin resistance, they become pre-diabetic. And you
Ah,
might be pre-diabetic for years and years before your pancreas wears out and you have to take medication. So
uh-huh.
if you're type 2, it doesn't necessarily mean that you have to take medication. You can improve it with lifestyle changes, like diet and exercise, of course,
Yeah.
stress relief and all of that. But some people do have to take insulin, and that's basically when the body is kind of diet and exercise isn't working. And no matter what you do, your levels are still high to like a dangerously high level that's going to cause long-term negative health.
Okay, I got it. So in other words, when you say resistance, it's actually the cells that are being resistant or right to that because they don't either it's not working or there's just not enough insulin to go around. And
Exactly. Yeah.
and you may have said this, but I might have missed it, that your pancreas is where you make insulin. I just want to, think
Yes.
you might have said that, but I might not have
Yes.
been
The
ADHD.
pancreas makes the insulin and gets released. And yes, the cells are not quite able to take on that, or the insulin is not able to get the sugar into the cells properly.
Okay, all right,
Yeah.
cool. And you said that. I just had to go over that again because
Yeah.
as I mentioned to Nicole, I have heard this explanation again and again and again, and there's something about it that I just can't get in my ADHD brain. So I love hearing the explanation again. So I didn't mean to interrupt, but I may have helped somebody else out there who has the same kind of issues. You never know, never know. Okay, so you mentioned that people with type 2 diabetes may have to take insulin just like people with type 1 diabetes, but perhaps for different, well, they both need insulin, but different origins of that, right?
Yes. So someone with type 2 could still be making insulin. They're just resistant to it.
I
And
got
so they tend to have to take much higher doses of insulin for it to
I
work.
got it. I got it. Okay. So you mentioned there were more types than just type 1 and 2?
Yeah, there's gestational diabetes,
Oh, okay.
which is during pregnancy. So sometimes people develop it during pregnancy, and there's not really any specific reason that you might get it. It really just depends on the person. That if you do have gestational diabetes, that increases your risk for type 2 later in life.
Oh, interesting. But
Yeah.
does the gestational diabetes diminish after you deliver your baby?
Yeah, it should go
Oh,
away.
okay.
For some people, they do have elevated levels after that point.
Uh-huh.
But for the most part, it should go away because it's the experience of being pregnant that is what's causing the
I
high blood sugars for them.
Okay, so it does, so being pregnant well, it affects about everything in your body, that's for sure, but especially your digestive system is what I'm hearing.
Yes.
Okay.
Yeah. So then the next type is called LADA. It's called now I'm gonna blank on the name. Basically latent autoimmune disease in adults. So
Oh.
it's like a type 1, but they call it like diabetes 1.5.
Oh.
It's
Almost
basically
a little more than one, but not quite two.
yeah. So it's like a type 1, but it happens later in life. So it's often misdiagnosed as type 2.
Got it.
So they have to tend to take insulin right away, and that's how you can tell.
Got it. Got it.
Mhm.
Okay, so I have heard that high blood sugar can do damage to organs, for instance, like your heart, which is one of the
Mhm.
reasons that sugar is now something that is, oh no, no, we don't want sugar.
Mhm.
So is that, you mentioned thirst, you mentioned some of the other symptoms, fatigue, et cetera, if you have
Mhm.
type 2 diabetes. Now, normally, unless you have the late onset of type 1.5, if you will, most of you out there are type 2 diabetic. It's more common than type 1. Am I correct?
Yes, much more common than type 1. And it's the one that's associated more with behavior and lifestyle. Like type 1 is not associated with that. It's not something that you can prevent.
Okay.
So yes, most people will have type 1, type 2. There's
All right.
actually, I think it's predicted now that 1 in 3 people in the US has prediabetes.
Yeah, I'm sorry, but I'm one of them. I'm not, I am sorry, but I keep thinking I'm going to do something about it. And I have gone off of sugar several times. So let's talk about the interaction of sugar. You mentioned an apple, which breaks down into carbohydrates, which breaks down to sucrose and glucose, et cetera, et cetera. But if we're just eating plain old sugar, if we
Mhm.
have, I don't want to trigger people, but let's just say a hot fudge sundae or something like that.
Mhm.
Does that trigger insulin faster just because it's already broken down into sugar components? Or can you talk about that a little bit?
So it really depends on the type of food that you're eating. So obviously food is complex. I mean, if you're just eating like a spoonful of sugar, then it's going to digest and it's going to break down very, very quickly. Your body's going to be able to absorb it rapidly.
Oh, okay.
If it's something like a sundae, though, for example, which has cream, milk in it, right? It also has fat and protein in it. That's
Mhm.
actually it's still going to spike because there's a lot of sugar in it, but it's actually going to be a slower process because of the fact that it does have those additional macronutrients with the protein and the fat.
Got
So sometimes it can actually cause a delayed release in blood sugar as well.
it. Hmm.
So there's so many things that affect our blood sugars though. It's the type of food that we eat, the amount, whether or not you've had that fudge sundae with a meal.
Mhm.
Because if your stomach already has food in it, we have to think about gastric emptying time. So how long is it taking you to digest? Are you adding fiber? Are you adding protein and fat? All of those things actually slow down the digestion in the gut. And that means that the longer it takes you to digest something, the more slowly that release of sugar is going to be into the bloodstream. So that means you're not going to get that huge spike. So
Okay.
your body's insulin is going to be released in response to the release of sugar into the bloodstream, right?
Got
So yes, your insulin levels will spike with the more amount of sugar that's in there, but there are ways to decrease that spike.
I got it. And especially fat, from what I understand, that's the thing that digests last in our system. So if you're trying to lose weight, for instance, you don't want to eliminate all the fat because that helps you feel full a little bit longer. Am I right about that, or did I?
So protein and fat both help to keep us full. Fiber does as well, though. So
Oh,
I take more of like a different approach, I would say, than other
okay.
people. I don't think it's necessary to completely cut out sugar. And actually, for the most part, that tends to make us more obsessed with it.
Yeah.
Especially from what I see in our communities, we are at higher risk for disordered eating. So it's important to include carbohydrates because it is our body and brain's main source of fuel. But there are certain types of carbohydrates that are going to decrease that spike. So, like I said before, high fiber carbohydrates specifically are going to be great. So it's okay to have, those foods that are high in sugar, but it
Mhm.
is best to try to pair it with something else. So, for example, having dessert after you eat your meal, or having, something that's a little bit higher in sugar along with your meal rather than just on its own to
Got it.
kind of help slow down the release.
Okay. The word that I wrote down was Coke. I mean Coca-Cola.
Mhm.
Any kind of sugar sweetened kind of things, we might not have them near a meal. We might have them with a meal, but we might
Mhm.
just be thirsty and we reach for something that's sugar sweetened. And I know that there's some conversation about how diet drinks can also spike insulin, which I don't quite understand that. Maybe it's
Mhm.
placebo. I don't know what that is, but my brain says it's sweet. So my body says, okay, I'll make insulin. I don't know.
Mhm.
But it just seems like that for ADHD folks, the connection between carbohydrates and dopamine seems
Mhm.
to be especially important. From what I understand, carbohydrates can activate dopamine, and that's what we really need. That's one of the things that we really need in our
Mhm.
brain. We need lots of other
Mhm.
neurotransmitters as well. So can you say a little bit about that? Or I may be pointing us in the wrong direction, in which case, never mind.
No, I think it's really important because that's one of the reasons why I think we are at higher risk for diabetes.
Oh,
Because so many of my clients come to me, they don't realize that they're actually using food for stimulation, right?
uh,
So if you're constantly understimulated or you're constantly stressed, right? Most of us have anxiety, depression, we have emotional dysregulation.
yes.
So we kind of turn to food in those times, right? Especially if you're feeling anxious or whatever. Food is sort of that emotional crutch that we use, whether it's boredom, stress. I always say it's procrastination is procrastinating. Like you're just eating to procrastinate, whatever the case is.
Yeah.
So if we're looking for that dopamine hit through food because you lack other ways to increase dopamine,
Hmm.
then you are going to be constantly having to release a little bit of insulin all the time. Now, in someone who's pre-diabetic, this doesn't necessarily mean that you're going to be harming your body in any way. Like your body probably is still making enough insulin to bring your levels down to a normal range. within a couple hours. But you can also do other things that are going to help not only bring your blood sugars down, but also boost dopamine instead of using food. And one of them is exercise, right? That's a big one.
Okay.
So moving your body is going to increase dopamine, but it will also help to decrease that post prandial blood sugar, which means after you eat, the amount of the blood sugar in your bloodstream will come down. But yes, I think when we eat a lot of sugar, we have to think about why. What is driving it? If you think about the bigger picture, though, Linda, it's most of us are chronically under eating. If you think about how much like stress we have throughout the day, we forget to eat. We avoid eating sometimes because we haven't have a meal planned. You might forget to go shopping. You don't have anything in the cupboard, or oops, I lost track of time, or oh, I'm taking ADHD meds and they completely zap my appetite during the day. So then what happens is when you finally do feel hunger, which is another one, we don't feel our hunger cues very well. We have poor interoception, which means we're not able to feel our hunger and fullness cues very well. So what happens is you're not hungry until your body's screaming at you, saying you're starving, you need to eat now. And then what happens is you overeat. And the first thing that your body's going to want at that moment is carbohydrates, because your blood sugar is probably starting to drop. So it's not necessarily a lack of willpower or anything like that. It's actually a physiological response a lot of the time. And so I want all the women listening to this to be empowered to know that there's not necessarily anything wrong with you. You don't need to cut out carbs. I think what we need to do is eat more consistently every few hours throughout the day to keep your blood sugars stabilized. Because when you don't, you're going to have those extreme highs and lows, right? From sort of overeating and then forgetting to eat, overeating and then forgetting to eat. And that kind of wreaks havoc on your whole day. So those binge episodes is also what's going to increase your blood sugar the most. So if we can prevent the binging by eating more consistently and including carbohydrates, proteins, and fats all together, that's going to be the best case scenario to prevent all of that that's going on.
Some years ago, I battled weight my entire life. I mean, I was a chubby I wore chubbies when I was a little girl, and I've been fighting it ever since. And one of the things that I tried was, I think it was called Sugar Busters diet. And what you did was eat carbs, fat, and protein at every time you ate. And boy, I just felt like it was much more smooth. When you described the highs and the lows, it almost reminded me of the way stimulants go into your system and then go out of your system. And probably for the same reason. So I'm fascinated by this. And so let's talk about stimulants for a minute. If we take stimulants, does that improve our chances of staying healthier and not developing diabetes or not?
It's a good question. So it really depends on the person. So I have clients who start stimulants, and because they have no appetite during the day, they're just doing more binging at night.
Oh, got it.
So then it's kind of, it doesn't really fix the problem. It's just preventing them from eating during the day. But for some people, like especially with Vyvanse, it's been known to help decrease binge episodes. So I think it can be helpful if you're somebody who's constantly seeking dopamine and your food is your first go-to, which is for most of us. And it can kind of prevent it that way. But you also have to have other things in place, like making sure that you are reminding yourself to eat every few hours. Some people need to use timers, put it right on your calendar. It's time to eat. And force yourself to have something small, at least. Don't skip a meal. Don't go longer than 5 hours without eating, which can happen with that, because you get into hyper focus and then it's like you don't want to stop because you're finally focused, right? But it's gonna bite you in the bum later on if you don't eat.
Yeah, I got it. I think a lot of us with ADHD don't pay much attention to what's going on in our bodies. Because we're all in our heads. I mean, if you know what I mean, we're thinking and we're thinking and we're doing and we're trying to catch up and we're running late and all the things that go on for us. And one of the things that I have just noticed very recently is that I don't usually eat breakfast, And I don't know, I think my apostat kicks in while I'm still asleep. And by the time I wake up, I'm not really that hungry. It's kind of past it, if you know what I mean. So I realized that there have been some days where it'll get to be 3 or 4 or 5, 4 o'clock in the afternoon. And all of a sudden I am just so exhausted. I'm yawning, I'm tired, and I'm thinking, what is wrong with me? I
Mhm.
got enough sleep last night, and it's because I haven't eaten.
Mhm.
So that energy source seems to be very, very important. And I don't know why I've just noticed it,
Mhm.
but because I have ADHD, right?
I would say that is so common. It's like, it's probably the most common thing that I see in all of my clients is the chronic under eating. But I think because let's say you overeat at night to sort of compensate for it, it's called
Yep.
compensatory eating. Then the next day you feel guilty or guilt and shame for it. And so you might say, I don't need to eat. I had a big, I ate a lot last night, or I'm going to make up for it, especially if weight loss is your main goal. But it's only going to make it worse. So I would definitely recommend continuing to eat every few hours. Um, and if you're somebody who really doesn't feel your hunger cues or your fullness cues, that's something that you'd want to work on
Ah,
to help you get in a better place. Sometimes we don't feel the obvious signs. It might be low energy, headache, kind of shakiness, irritability. That's a big one for me. I start getting like hangry, and my husband's like, I think it's time for you to eat now.
and the people around you are saying, I think she needs food.
Yeah.
And especially in your family, I'm sure that it's kind of like, and you know better, you're not, that kind of thing.
Mhm.
Okay. Okay. So I have read that there is research that says ADHD folks are at higher risk of type 2 diabetes. Is that your experience as well?
Yeah, I mean, if you just think about all the risk factors, I mean, the research that I've come across is because it's mainly due to like the comorbidities of anxiety and depression, substance
Mm,
abuse, but I've also seen it be linked to like oxidative stress, inflammation. But if you think about the sort of things that we tend to be higher risk for as well, like a lot of us have PCOS, sleep apnea, things that are going to cause more insulin resistance, and sleep apnea itself also is going to affect your blood sugars. It's going to cause more stress in the body. Stress itself, though, has a huge impact on our blood sugars. If you're constantly stressed, your body is going to release, or your body's going to have higher blood sugars. So the
really?
sleep
Why?
quality hormones.
What is that? Why, if you're stressed, do you have higher blood sugar? I'm confused. Is that to give ourselves more energy? I don't understand that.
Well, cortisol is a stress hormone that plays a role with it. So anytime your hormones are involved, it can affect uh,
uh,
it can affect your body, and it's going to increase blood sugar. But if you're in fight or flight all the time, which a lot of us are,
yeah.
um, it that your body has that response, like your blood pressure is up, your awareness is up, your blood sugars might go up. There's kind of a lot of a physiological response in the body.
Yeah.
So reducing stress is a big one for reducing your risk. But yeah, I mean, if you think about the higher risk for binge eating disorder, just the inability to be consistent. Some of us also don't really are not consistent with medical care to get our blood sugars checked to
Yeah.
see that we might be at being high risk. So there's a lot that goes along with it.
Wow. That I'm so grateful that you mentioned all that. As I shared with you before we even started recording, I've had a stressful week or so, and so I can just feel myself. I'm not stressed now because I'm sitting here with Nicole and with all of you, but I can just feel that there's this level of tension and stress that's still there, even though the event has passed. I'm home. You know what I mean?
Mhm.
So it feels like there's some residual stress. Probably the cortisol doesn't go down as quickly as I'd like it to, or whatever it is. So how do we deal with, in my case, prediabetes, or
Mhm.
how do we keep from even getting to prediabetes, or if we have a diabetes diagnosis, what's the best way for ADHD folks to handle it? Because taking pills or taking insulin, that's one more thing to remember, to remind ourselves about. What are your best tips for all of us ADHD folks out here?
Yeah, it's a good question. I mean, if you if first off, if you do have a diagnosis and you are supposed to be taking medication,
Mhm.
um, I would highly recommend trying to come up with some sort of a system to remember to take it,
Okay.
because the side effects of having high blood sugar all the time, it really can do a lot of damage to your vessels. So
Oh,
I think that's to kind of answer your question you asked earlier, but sugar is a very sharp molecule. So if you think of it like this sharp molecule that's going through your vessels, it's going to kind of scrape it as on
ooh,
its way through. Think of it like that. And so that this isn't like when you eat sugar, this happens. This is like high blood sugars for a long period of time are going to damage the tiny vessels. So it can damage the vessels in your eyes, in your nerves, in your kidneys and things like that. So, and this isn't to scare anyone. This is just to say, like, if you do have a diagnosis of type 2, you do want to try to make sure that you are setting alarms, alerts, reminders, whatever you need to do to take your medication if that's what you're supposed to be doing.
uh-huh.
Um, it can also help to kind of task batch, or I forget what it's called, task stack. So
Oh,
like if you need to take your medication in the morning, let's say try to pair it with something that you already do regularly,
yeah.
to make it easier. That's a good one. But in terms of just regulating your blood sugars and trying to prevent or manage, it's the same exact thing, prevention or management.
Okay.
Um, do not skip carbs completely. We don't need to do keto. You don't need to go on a very low carb diet. I know that a lot of physicians out there will tell you to do that, but it's actually pretty harmful for us, because what we find when you start cutting things out is you make it more exciting. And when things are more exciting for us, what does it do? It creates more dopamine when you do get it.
Yeah.
So we don't want to be chasing the dopamine from the carbs that you can't have and make it more exciting. You actually want to neutralize it. So that means giving yourself permission to have it, but in a way that you're going to be mindful. And in order to be mindful to eat, we need to make sure that we're not waiting too long to eat. Because once you pass that threshold of excessive hunger, you're going to be more impulsive with your food choices. You're going to probably overeat in your carbs. And it's just harder to stop eating when you feel full. So eating consistently every few hours, I would say every 3 to 4 hours, check in with your body, see what you need. Do I need carb, protein, and fat? I always tell my clients to make a list of your easiest meals. Like, I don't care if you're a really great chef and you're really good at cooking. Just because you can cook doesn't mean that you have to. You can just like ready-made meals, things that are easy for you, grab and go. Like, those things are the best for us. We don't need to do like a really difficult meal plan or anything like that. Just do what works for you. Um,
Mhm.
I would say the other thing that I didn't mention that has been shown to really reduce the risk of diabetes is adding in more plant-based proteins.
Oh,
So
okay.
excessive amounts of animal protein can sometimes increase insulin resistance. So plant-based proteins have been shown to help to reduce. So I wouldn't say that means you need to go vegan, because it can be hard to get enough protein, and then that's going to negate
Yeah.
the effects. But if you can get some plant-based proteins in, so that means adding things like beans, lentils, nuts, seeds, tofu, those types of things can be really helpful. Maybe if you can add them in a couple times a week to start. The other thing I would say is exercise. So movement, if you can, if you're able. I understand some people listening might not be physically able to move their bodies, but if you can, um, exercising even just like 5 or 10 minutes after a meal is going to really help to bring those
Oh,
postprandial blood sugars down.
hmm.
It's also going to help with ADHD symptoms and sleep and all of that. So, exercise can't hurt, but you don't need to go and do this crazy long exercise routine. Even like walking for 5 to 10 minutes after a meal can be helpful.
Oh, wow. And a lot of people take a walk after a meal. It's like it settles everything kind of. It's like taking a walk after Thanksgiving dinner.
Mhm.
But that's an exceptional meal, right? That's perhaps excessive meal, that's for sure. All righty. So what I'm hearing is we don't have to cut out all the sugar. As I mentioned, my grandfather had diabetes, but he always had a little bag of M&Ms in the corner somewhere because he was feeding it, right? And
Mhm.
and speaking of having a bag of sugar in that respect, with people, some people need to have instant sugar. So they'll like drink orange juice. I guess that's more type 1 people who need that kind of instant renewal of their sugar. Is that right?
Yeah, I think, well, it's common with type 1 because they're more likely to have low blood sugars because like if you take too much insulin, for example, or you exercise and your blood sugars come down. But you can
Okay.
also get it, you can also get those feelings of low blood sugar, like anyone can get it. But of course, with type 2, you can have it if you're taking certain medications, or just what happens is if you do eat a lot of sugar, let's say, like amount that's more than what you'd normally have in a meal, you might get that quick release of insulin and then also quickly decreases your blood sugar. So you almost get that like, there's like a sugar rush and then a drop afterwards, right? And so that drop might leave you feeling like you need more sugar afterwards. So in order to prevent that, that's why I said to eat things that have fiber, fat, and protein with it so that you get a nice slow release. You don't get that quick increase and then the decline afterwards. So yeah, that needing some orange juice or something to increase your blood sugar quickly, that is more seen with, type 1 or somebody who's taking insulin.
Got it. Okay, got it. And those of you who are newly diagnosed with diabetes, it probably feels overwhelming to feel like there's, oh, it's just one more thing. And can I blame my ADHD for this? No, you can't blame your ADHD for this. But it does make it challenging. It may be a change in the way you approach food. I love the fact people talk about sugar comas, but food comas, and I find sometimes, and I'll probably have to pay more attention to what it is that I eat, but sometimes I will eat a meal and I will just be an hour or so later. I'm just like, I want to take a nap. Maybe that's why we have siestas. I need to start taking siestas. I don't know. So, okay. So we've covered a lot of ground here, and thank you for allowing me to interrupt and ask some questions that I needed clarification about. What else is there that we need to know about diabetes and ADHD to the combination? What else is there we need to know about that?
I think there's a couple things. One thing that we didn't cover with the stimulants is that if you do have diabetes, then stimulants or even non-stimulants can increase your blood sugars slightly. So
Okay.
some people need to increase medication or insulin when they take them. There hasn't been a link that shows that stimulants cause diabetes, but they can slightly increase your blood sugars. The other thing, a couple other things I would say to improve your management would be if you are somebody who has type 2, you can see if your doctor will allow you to get a CGM, which is a continuous glucose monitor. So obviously there's so much management involved when you have to check your blood sugar. So if you have pre-diabetes or even type 2 that isn't, quite as severe, then your doctor might just be telling you, check your blood sugars after meals and see how it goes, or check them once in a while. But for people that do have type 2 that have to check their blood sugars quite often, like at least a few times a day, that can be really hard with ADHD. I mean, we forget, you forget to take it at the right times, or you might forget to take your medicine at the right time. I mean, there's just so much to do with the management of it. So if you can get your doctor to prescribe a continuous glucose monitor, that can make such a difference in terms of seeing how your blood sugars can be managed, because a continuous blood glucose monitor, it's just a little device that you put typically in the back of your arm. You can put it on your abdomen. And it checks your blood glucose constantly. And there's a little app that you can get on your phone where it actually shows you your blood glucose reading so that you don't have to constantly prick your finger. And so it just makes it a lot more manageable, and you can see how different foods and things and exercise and all of that is going to affect your blood glucose levels. It's not for everyone, but if you're somebody who is struggling to check them frequently, then I would ask. Now, the one downside of this, and this is something that I wish physicians would be educated on, so if there's any physicians listening, please give your patients some slack on making them do blood sugar logs. I've had so many clients before. So before I got diagnosed with ADHD, I used to work as an insulin pump rep. And I was putting patients on insulin pumps and managing their, insulin and all of that. And there's so many times when the patients really, really wanted a CGM, but the doctor would not give it to them unless they had 30 days worth of blood sugar logs.
Oh,
I
wow.
could see the ones that had ADHD because they would forget. They would do 20 days and then the last 10 they would just forget. And so they'd have to keep starting over again. And their care and their health was just degrading as they went because they couldn't get those 30 days of logs. So I would love if we could push doctors to allow them to get the CGMs without it. Now, there's some that you can get that aren't as they're not as accurate, but they're still helpful. So
Got it. Thank you for that. And there are physicians who are listening, I promise you, because we try to serve everyone, but I'm thrilled that a lot of professionals join the ADHD Women's Palooza just simply because they also want the most up-to-date information for their patients and for their clients. So I'm really appreciate the fact that you mentioned that. So even though we've covered a lot of ground, I know that because of our working memory, some of us have forgotten what you said at the beginning of the session. So give us the succinct message that you really want, or messages that you'd like everyone to take home from our session today.
So what I would say is that just having ADHD, it does put you at an increased risk for diabetes. But I don't want it to scare anybody. What I want it to do is to empower you to make some changes and think about your life as a whole. So if you are somebody who's been told that you have higher blood sugars and that you need to go on a diet or you need to lose weight, which is usually the first thing that doctors tell us to do, think about what that is going to do to you. Because sometimes when you go on a diet, well, first of all, and this could be a whole other conversation, but we know that people who go on diets, it doesn't work long term, especially for us, right? 2 out of 3 people who go on a diet to lose weight end up gaining more weight than they started with. That's been in the research. Because of metabolic adaptation, there's a change in the way that your body's metabolism works. Your body just wants to survive. So I would say don't do anything drastic. What I would say is focus on how to add things in rather than restrict. So rather than cutting out carbs, rather than cutting out sugars, think about what you need to add into your life that is going to improve it. So I need to add in more regular meals. I need to add in fiber, fat, and protein. I need to add in exercise, right? Rather than I need to cut all these things out and then it makes it so stressful for us. And then we're like, I don't know what the heck I can even eat anymore. And then that's why we end up failing because it's too overwhelming. So focus on what you like, what's going to be satisfying to you, and look at your situation as a whole. If you need help with it, then working with a dietitian can be really helpful.
Oh, so speaking of working with the dietitian, that was a perfect segue. Tell us a little bit more about your ADHD community and et cetera. Can you tell us a little bit before we leave?
Yeah, so I have a course, I do coaching, and it's a whole community at eatingwithadhd.com. You have access to all the steps that I take my clients through, everywhere from how to eat to how to meal plan and shop and cook with ADHD, which of course improves blood sugar regulation, exercising, how to have an improved relationship with your body image, and with food, so that you're not having to cut these things out and weigh and measure and count and all these things that are really stressful for us. So if you are interested in that, you can go and sign up for the course, or you can add on one-on-one or group coaching with it if you want some more accountability.
Cool. Thank you so much for that. And we met a couple of years ago when you were just on the verge of having a baby. And I don't know whether it was set up then, but as fully as it is now, but I'm just thrilled that there is this resource because I think it's desperately needed, and you will be getting my check in the mail tomorrow. Or whatever. And I'm really serious because I feel like this is one of those things that has always felt a little bit out of my control. And I tend to overcompensate by controlling it too much. And let's face it, there are a lot of things out there that say, this is the answer. And I've tried a lot of them. God, way too many of them probably, which is also not so great to have all these different kinds of diets and eating plans going on. So I would love, like, just as you mentioned, I went to a dietitian once upon a time years ago, and I thought, okay, this is going to give me the exact thing. And it still didn't help because she wasn't really dealing with the ADHD issue. So the fact that you understand that and give counsel with that in mind, I think is tremendously important, which is another reason I'm so grateful that you have shared your expertise with our audience. Thank you.
Thank you.
Nicole.
Thank
Really
you.
appreciate it. All right, everyone. I know that you probably have enjoyed this as much as I did, but maybe not, because maybe I enjoyed it just enough for everyone, because I loved it. Don't forget, you can watch this again if you have anybody with diabetes in your family, because it can run through generations, just like ADHD can. So if you have anybody with diabetes and ADHD, or maybe they are not even diagnosed with ADHD, who knows, send them this link. I think that they're going to appreciate hearing, even without the ADHD connection, a lot of the wisdom that Nicole has shared today. Of course, you can listen to it for free for 27 hours. Invite anyone you'd like to the Palooza and all the other sessions that were released today. You have those as well. And of course, you have those morning meditations for yours to keep forever. So you can watch and listen to those forever. I do want to invite you to Saturday. Again, we do have limited space there. So if you really are interested in signing up, do so quickly. One year we had so many people sign up that we had to have a second one, and we called it the purple ticket party. It was the following weekend. So rest assured, if we can do it, we will make sure to accommodate you. There's a small fee, but we will have some of our experts there, and you can ask them questions directly to them, instead of simply us just talking to you. So, and you can talk to each other, as I mentioned. So much more to come. Thank you, thank you, thank you for joining us. And thank you, Nicole. Always a pleasure.
Thank you, Linda.
What a great session, eh? And if we did